Epygenix Therapeutics is a clinical stage biopharmaceutical company developing investigational drugs for Dravet syndrome and other genetic epilepsies. Dravet syndrome is a rare and intractable genetic epilepsy that begins in infancy. Because current therapeutic options are not sufficient, patients need constant care for their entire life. Dravet syndrome, like most genetic forms of epilepsy, is an orphan disease with an unmet medical need. Epygenix Therapeutics obtained multiple investigational drug candidates for Dravet syndrome based on zebrafish screening system from Professor Scott Barabin's lab at UCSF. Among them, EPX-100, also called clemizole hydrochloride, which has been cleared in the Phase 1 study with healthy subjects, is now being tested in patients with Dravet syndrome in a 20-week, multi-center, randomized, double-blind, placebo-controlled trial as adjunctive therapy. This EPX-100 clinical trial is named as the ARGUS trial. The goal of the ARGUS trial is to evaluate the efficacy of EPX-100 orally as adjunctive therapy compared with drug-free placebo in terms of mean % change in countable convulsive seizure frequency in the titration and maintenance periods relative to baseline. To participate in the ARGUS trial, you would need to meet pre-specified eligibility criteria. At a minimum, these criteria include 2 years and older, clinical and genetic diagnosis of Dravet syndrome, seizures not adequately controlled by current anti-seizure drugs, experience 4 or more convulsive seizures during a 4-week baseline period. More information on the ARGUS trial can be found on clinicaltrials.gov, NCT 044-62770. In the ARGUS trial, your personal data will remain private and confidential. Any medical data collected in the study will be used exclusively for therapy development. Our aim is to develop transformative therapies to improve the quality of lives of patients and families living with Dravet syndrome. I encourage you to participate in the ARGUS trial.